Welcome back to HealthWatch, presented by Novant Health. I'm your host, June Baker. Today our show features 3 local health professionals discussing some very important topics which I think many of our viewers will find helpful. Today our guests include Nick Sandella, Manager of Radiology at Novant Health Brunswick Medical Center, regarding imaging services. We'll also talk with Rebecca Green, a registered nurse with Lower Cape Fear Hospice, and she'll share information on fall prevention. In addition, we'll also speak with Teresa Mabe, a financial counselor at Novant Health Brunswick Medical Center, who will tell us about the new Financial Navigator Service. Stay tuned to hear more about these valuable topics with HealthWatch. Our first guest today is Nick Sandella, Manager of Radiology at Novant Health. Welcome to the show, Nick. It's such a pleasure to have you.
Thank you. I appreciate you having me here today.
You're welcome. Now, I know that you've recently joined Novant Health Brunswick Medical Center, so most of our viewers probably have not had the opportunity to meet you. What is your role at Brunswick Novant?
I am the Manager of Radiology Services at the hospital, and I joined back in December of last year after relocating here from Manhattan.
Mm-hmm. Quite a shock,
yes.
Right? Quite a culture shock. Well, let's talk about your education and your background. How did you get to be where you are today, Nick?
Okay. I have a degree in nuclear medicine, and I graduated in 1996, and I've been an imaging professional since. I'm board certified in nuclear medicine as well as computed tomography. I've worked in many facets of the industry, which range from a clinical technologist to a research technologist, academia where I taught, as well as in research and development for pharmaceutical companies.
Wow, quite a bit of experience, and across the board, you've done just about all aspects of that.
Yes.
That's awesome. Well, we're here today to talk about the imaging services that Novant Health provides locally. Can you give us a brief overview of the different types of imaging services that are available here?
Yes. Our facility is a full-service radiology department. We offer general X-ray and fluoroscopy, special procedures, as well as computed tomography, CT scan, mammography, MRI, ultrasound, nuclear medicine, and vascular imaging.
Wow. Pretty much got it all covered.
Yes, ma'am.
Well, let's talk about some of the various reasons that patients might need imaging services.
Sure. Well, we provide both preventative care screening procedures as well as diagnostic procedures. An example of a screening procedure would be a woman's annual mammogram. Some of the diagnostic procedures that we may encounter are something as simple as evaluating a bone for a fracture or a break, or something as complex as an MRI scan looking for different various reasons for back pain, staging different types of tumors and cancers, utilizing ultrasound to document pregnancies, and a wide spectrum of diseases and disorders that we can evaluate using imaging. Every patient who walks through a hospital at one point in time will be touched by some form of imaging.
Yeah, I know I've had many myself, so yeah, I could attest to that. Well, how many days in advance would a patient need to make an appointment to have any of those imaging services at Novant Health?
Okay. Depending on the preparation for the procedure, or if there's any authorizations that are required by their insurance company, we can pretty much provide same-day service for most procedures.
Wow. That's great.
Yes.
I mean, I assume that with ones that need additional prep, it might take a few days,
Correct.
but we're typically able to get them in very quickly.
Correct.
Good, good. So can a patient come to the hospital for their imaging study, even if they've been to another facility in the prior to that? If they've had it done somewhere else, can they come to Brunswick, Novant?
Of course, we can accommodate a patient who comes from another facility, especially since this part of the area, we have a lot of patients who come from other parts of the country for vacation reasons, and we make every effort to contact those other facilities if they've had prior imaging studies so that we have them and we can import them into our system for comparative reasons.
Oh, that's great. That's great. Now, oftentimes when folks work, it's difficult to schedule an appointment, and I'm wondering how easy or how difficult it is to get an appointment. Do you have various hours or weekends? Let's talk about that a little bit.
We try to make it as easy as possible for the patients because everyone's life is busy, and last thing we need to do is take time off from work for an appointment. So we offer early morning appointments, late evening appointments.
When you say early morning?
We generally start between 6:30 and 7 a.m. depending on what type of test it's for.
Right.
We also are pretty much, for most of our modalities, we schedule out as far as 7 p.m. and we have weekend hours. Saturday is a regular working day for us, so we're open at 7 a.m. and usually close around 7 p.m.
Wow, that is an extended time period, especially on Saturday.
Yes.
That'd
we find
be
most
great.
patients appreciate that flexibility.
Well, that's very convenient for folks here in Brunswick County.
And for our diagnostic work, for our x-ray work, we offer walk-in appointments, and you can walk in any time and have an x-ray done.
Wow, that's great. I've heard that we have, or you have, this new open bore MRI machine. Let's talk about that a little bit and go into a little bit of detail about that.
Well, we have the GE 450, which is an open bore magnet, and analogically we use the word open bore as the donut hole.
That's that big hole
That's
you
the big
go
hole.
into, right?
And that hole is about 70 centimeters wide, and
Okay.
it's the largest bore or donut hole in this area. And what that allows is patients who are claustrophobic to have a little sense of control and ease over their procedures because of the fact that it's so wide, without compromising the image quality. Some other additional little perks that the scanner and the layout of the room have is we have ambient lights in the bore, so it's not dark, it's very bright. We also have a large window in the room that you can see from the bore, so it gives another sense of openness.
Let's talk about pre-medication for MRIs. Because of the size, has that done away with some of the pre-medication?
Well, it depends. For patients who have that slight anxiety about it, the size of the bore definitely helps. Our technologists are well trained in how to coach a person through the procedures, and the technology that we have has decreased the amount of time that the scans take. So generally with those three combined, we can get those patients through them without any type of drugs that would help relax them. But at times we have patients who have very, very high anxiety, and we'll have drugs prescribed to them to help them get through it. They're usually very short acting, and all we ask is that someone accompanies them with them just to make sure they have a ride home after taking them.
Sure, sure. That's great. Now, other than the imaging services provided at Novant Health Brunswick Medical Center, are there any other facilities in the area which provide imaging services for it?
Within our network, yes, we have an outpatient imaging facility in the south end of the county in Sunset Beach, which has x-ray services, which are walk-in, and we're open Monday through Friday, 9 hours a day. And many of our family practices, like Oceanside Family Medicine in the South End, has their own imaging capabilities with x-ray, bone density, and ultrasound.
So there are other avenues for imaging services other than the hospital.
Correct.
So
Correct.
those folks living in the southern end of the county, like the Calabash area and such, that would be much more convenient for them if that service is available there.
Correct.
At the Sea Trail location.
Correct.
Well, that's good. That makes it really convenient for those folks living down that way.
Yes, ma'am.
Now, how would a patient go about scheduling imaging services at Novant Health? What would be that process?
Well, we have a couple of variations. If the patient is seen in the physician's office, the appointment can be made at that time with their physician by the office calling and
Sure.
scheduling the appointment. The patient can call from their home to have the appointment scheduled by themselves, and we will also, if we get a request from the physician for us to call the patient to set it up, we will do that as well.
Great, great. One other thing about mammography, I meant to ask this earlier. Does a woman need an appointment to have a mammogram?
No.
Or an order?
For screening mammography, as long as the female is 40 and plus, and that does not require them to have a physician's order, and they can come right in and make an appointment, or if there's availability that day, be seen that day.
Okay, great.
And we just ask them to provide us with a physician's name and phone number or fax number,
Sure.
so we can send the report on to them. But they'll also receive a letter in the mail within 30 days that the results are available.
Well, that's good. I think that's important for folks to know that it's easy to get a mammogram and you don't need a physician's orders.
Correct.
Thank you. Well, it's been a pleasure having you here today. I look forward to having you back, and we'll talk about something else to do with radiology.
Great.
Thanks
Thank you.
again.
Appreciate you having me.
You're welcome.
Thank you.
Our second guest today is Rebecca Green, a nurse with Lower Cape Fear Hospice and Life Care Center. Well, welcome to the show, Rebecca. It's such a pleasure to have you.
Thank you.
Now, to begin with, I would like to learn a little bit more about you and your background and your education. So if you would share that with me and our viewers.
Okay, well, I got my ADN at Southeastern Community College, and after that I worked on the med-surg floor at Brunswick Community Hospital.
Wow.
And then there was an opportunity at Lower Cape Fear Hospice, and I had actually done some training while I was a student at Southeastern. So I felt like I fit really well with hospice and their philosophy. So I started working there as a home nurse about 11 years ago, and I did that for 8 years. And then there was an opportunity for a new position called the clinical nurse liaison, and I accepted that position, and that's what I've been doing for the past 3 years.
And I bet you're wonderful at it. You have such a great personality. I'm sure you do a great job at that. And that's such an important role.
Well, thank you.
It's a wonderful organization, and we're so happy to have you here today.
Thank you.
But we're here today to talk about fall prevention. And I understand that's a pretty important topic, especially in our senior population. But I'm curious, how often do falls really happen?
Well, studies have shown, surveys have been taken, and they say about 1 to 3 adults over the age of 65 will fall every year.
Really?
Yeah.
That's pretty significant.
It is. It is.
Wow. What seems like falls would happen mostly to seniors. Is that an accurate statement, or?
There's 2 age groups.
Really?
Over 65, and of course, as you increase in your age, then the increase of fall risk then goes up. The other age is 5 and under.
Oh, our babies, huh?
Trying to walk and learning how to navigate. They're the other risk factor.
Now, of course, when you fall, there's always the physical injury, and I assume it probably reduces independence and mobility. But are there any other things that can occur after a fall?
Well, patients usually then become afraid.
Oh.
So they're afraid they're going to have another fall. So they will stop being mobile.
Oh.
And, you know, when you stop using something, then you have a potential to lose it. So the mobility, the flexibility, the strength, the balance, all of those factor into then having a reoccurrence of a fall.
Well, how about risk factors? Are there certain folks that are more prone to falling?
Well, there are folks that have certain medical conditions that are more prone to falling besides just the age factor. You have people that have diabetes, and if you've had diabetes for a while, you start getting side effects, which we call peripheral neuropathy, where you can't feel your feet.
Wow.
So if you can't feel your feet, you don't know where you're stepping, and that can lead to a fall. Patients that have had strokes, patients that have lung disease, because when you try to do things and you become short of breath, you can then...
I thought of that.
And then the other factor is the other patients are heart patients. And there are a lot of reasons why: medication that patients are on, lifestyle, home hazards.
Oh, yeah, that's probably a biggie.
Yeah.
Well, how can healthcare providers help someone if they are at risk for falling?
We think you need to sit down and talk with your patient, and you need to review their medications. It helps if you have one pharmacy. So you have one pharmacist looking at your medications, looking at the side effects, and a lot of times too with your dosing and your timing. So if you're on a medication for pain, but you're also on anti-anxiety, both of those medications can cause you to be drowsy. So you might not want to take those together. So there's a lot of drugs that interact with other drugs that you might want to talk with your pharmacy or your doctor about. Regular eye examinations, because as we get older, we need brighter lights. So if we're walking around in a house that we have 40-watt bulbs with oxygen tubing and rugs that are loose, then there's a lot of potential for falls.
So it sounds like a lot of it is common sense and just looking at your surroundings and being aware, more aware, and having good conversations with your physician as well as your pharmacy.
Absolutely. Physical activity and being able to admit, because we're also independent.
Yes.
And we don't want to tell our doctor or our spouse or our family, I'm having problems.
Well, Rebecca, I'm curious, are there any medical tests that can be used to identify the reason a person falls?
Well, a fall usually is the symptom of a problem, not actually the problem itself. So there are medical tests to find out what a disease process is, or if you've had some kind of acute occurrence. But usually a fall is a symptom of something else
that's
happening.
going on?
Yes.
Yeah, okay. Well, that makes sense. Does physical activity typically reduce one's risk of falling?
It does. Studies have shown that people who stay physically active have less incidence of falling. A lot of times older people aren't sure what to do, or you hear those things are good but they're high impact, so we have knee problems. So things like yoga, doing weight training with your legs to keep your legs strong, and Tai Chi, those things. And if you are one that goes to the gym, the elliptical trainer is better than the treadmill because it's low impact.
I was going to ask you that. I wondered what kinds of exercises would help, for instance, me to reduce the risk of falling. And I do go to the gym, but I typically use the treadmill. So you're saying elliptical may be the better choice?
Because of the low impact, yes.
And what about weights and machines versus isometric and things like that? Is there much difference, or would the outcome be pretty much the same?
I think it would pretty much be the same. If you're using this lower weights, you're not really going into do any kind of muscle building. You're just trying to do strength training. And it's all of that together. It's the flexibility, the strength training that help you reduce your falls.
How about Zumba, things like that, or dancing kind of exercises? Are those good?
High impact.
High impact.
Yeah. So depending on what other conditions you have, they may be fine or they may not be.
Right. Well, are there any tips out there that viewers could do around their house to prevent falls? I know you talked about the rugs and things like that. Can we kind of go over that again just to
Sure. Depending on where you are, if you're having problems, grab bars on the stairs.
That's a good
On
bathtubs, I would think might
the
be
bathtubs, beside the commode, shower chairs
Mm-hmm.
in the bathtub, because if you're having problems with endurance, you might have a hard time standing just to take the shower. So
Mm-hmm.
you get one of those shower nozzles that come down, get a shower
Right.
chair, and you're good to go. Lighting is a big one. Cords, loose rugs, things like correct fitting shoes. Not flip-flops, more like tennis shoes, socks with the little skidders on the bottom so that you're not falling.
Right, those are all great ideas. That's great. Well, Rebecca, it's been a pleasure to have you here today. I know I've learned a lot about fall prevention, and I hope that our viewers have too. And we look forward to seeing you again in the future. We'll talk about a different topic.
That would be great.
Thanks
you
again.
so much.
You're welcome. Our final guest today is Teresa Mabe, a financial counselor at Novant Health. Welcome to the show, Teresa. What a pleasure to have you.
Thank you. Thank you.
Why don't you tell us about your role at Novant Health?
I'm a financial counselor at the Brunswick Medical Center, and I work with mainly uninsured patients, but we do anything concerning billing or questions they have with insurance.
How long have you been working at the hospital?
I've been there 3 years.
3 years. Well, we're here today to talk about a new service that I've heard about that Novant Health is offering, and it's called Financial Navigator. Tell me about what that is. What is a Financial Navigator?
It's a great program that Novant set up to service our, I want to say patients, but it's for anybody that might have a upcoming procedure or even thinking about a procedure. They can call this service Monday through Friday from 8 to 5. There's always somebody that will answer, and they can give them information on the pricing. Then they can take their insurance information, let them know what their costs will be for the procedure, because that's a scary process for somebody to come into for, say, an MRI and not know what their portion will be when they get there.
So let me understand, if I'm going in for surgery, like in a couple of weeks or something, and I'd like to know how much it's going to cost me out of pocket, I can call the Financial Navigator. Is that correct?
That's right. That's
And walk me through that process. What is it that the Financial Navigator would do first?
What you would do is call and have your insurance information in front of you. The procedure code would be good.
I would need to know the
Yes.
procedure.
You need to know the procedure. If you can get it, the CPT code, and you can just ask your doctor or anybody that works in the office.
I can get that information from my doctor.
Yes.
So I would call the Financial Navigator and I would tell them what I'm going to have, what procedure or what CPT code it is that I've gotten from the physician, and then what happens?
We can put this, we have a program and we can plug this information in along with your insurance information, and it will give back to us what the cost of the procedure would be, what we're going to bill the insurance, and then what your cost would be after insurance is paid. This is just an estimate, but we get as close as we can with the information that we have at that time.
Would the Financial Navigator contact my insurance company if necessary?
No,
How does that work?
That would be for our insurance verification department, which would do that, especially if it was a surgery. They would take care of that. We are just for estimates. The Navigator is just to give you an idea of what you're going to be responsible for after insurance.
Well, that way it's not such a big shock.
Right,
I mean, it's,
right.
you know, after you've had the surgery and you're going home, it's kind of scary when you see what your portion's going to be.
That's
so
right.
this way you're much more prepared.
Well, and another service they offer is we give you options of payment. We have some financial plans that we can work with you on payments, or how we work to pay in-house. If you want to pay up front, we have some new programs for financing, 0% interest. So we do let you know that those are available. We can mail out an estimate letter to your home.
That was my next question. I know this is a phone procedure where we call the Financial Navigator. I was wondering if it's possible to get an estimate in writing.
Oh, yes, yes. We would be glad to mail that out at that time if they would ask.
I know you said it's an estimate, but in your experience, is it pretty accurate? Is it pretty on?
It is. We always say estimate because it's an individualized service. When you come in for an X-ray, we don't know that you may have to have a retake, or maybe the doctor calls and says, will you add this to it, and call in another order. So we don't want to tie it down and say this is exactly what you'll owe. So we do as close as we can to an estimate, but from what I've seen, it's pretty accurate.
Well, it sounds like it's a really great tool and would be extremely beneficial to our patients. I'm wondering, what does it cost to utilize this service?
It's free.
It's free.
It's free. And there is a toll-free number, and I don't know if you've shown that yet.
Oh, that's great.
Okay. There's a toll-free number, but we also do that locally. If you are in the hospital or coming in for your procedure and you want to see a financial counselor, they can ask at registration. We are in registration. There are two of us.
That's what I was going to ask you. How would I find the Financial Navigator at the facility?
Right. Well, we are in the main entrance at registration. As everybody that would come in for a procedure would go through registration first. They can always ask to speak to a representative. I'm there, and also Janet Randone is another financial counselor. We're right there in registration. Always glad to help. We're a phone call away. So, you know, a lot of people had rather deal locally or deal on a one-on-one, face-to-face. We also can take payments right there. We can help with setting up payments at that time. So it's a convenient service. I think it's a really good service for our patients, even potential patients.
Right. Now, is it just for surgery, or does it, could you utilize this service for like an imaging procedure, like an MRI, a CT, something like that?
Anything, yes. Outpatient surgery. We do a lot of new mothers. We do birthing.
Oh, birth, yeah. So any of those services,
Any of those.
you could
Anything
help.
we do in the hospital, we can help with the financial aspect of it. We can give an estimate.
Well, that's great information, Teresa. And for our viewers out there who are interested in using this tool, how can they get in touch with the Financial Navigator?
Okay, they can call Monday through Friday from 8 to 6 at 888-277-3907.
Okay.
Or they can call the hospital at 721-1000 and just ask for a financial counselor.
Awesome information. Well, thank you so much for being here today. It's been a pleasure. And I think this is a great tool, and I think that it will be very beneficial to your patients and the residents of Brunswick County.
Well, we're excited about it too.
Thanks for being here.
Thanks for having me.
Thank you for tuning in to ATMC TV's Health Watch, brought to you by Novant Health. I hope this information was beneficial for you and your family. If you have any questions or topics that you would like to see on a future show, let us know at atmctv.com. For more information on Novant Health Brunswick Medical Center and local doctors, visit novanthealth.org. Thank you again for joining us today. Be sure to join us next time for Health Watch on ATMC TV.
Is 6:30 too early for a Get Fit workout? Are your weeknights too hectic to catch the West Brunswick football? Do you find yourself missing all your favorite ATMC TV shows? Well, now you don't have to. ATMC TV is airing all their latest shows on demand. Stop, pause, fast forward, or rewind. Watch your shows on your time. Tune to Channel 1 to see shows like Brunswick Biz, Get Fit, The Coastal Kitchen, and more. Stay connected to beautiful Brunswick County with ATMC TV On Demand. Brought to you free by ATMC.